Homelessness often serves as both a cause and a consequence of drug abuse. Individuals experiencing homelessness frequently confront a myriad of stressors, including lack of stable housing, unemployment, and social isolation. In an attempt to cope with the harsh realities of life on the streets, many turn to substance abuse as a means of escape or a way to self-medicate underlying mental health issues. The connection between homelessness and drug abuse is further underscored by the financial strain experienced by individuals living on the street. The need for daily survival, coupled with limited access to resources, can drive individuals to engage in illegal activities, such as theft or panhandling, to support their substance abuse habits. This cycle of desperation often perpetuates a downward spiral, making it challenging for individuals to break free from the grip of addiction. Conversely, drug abuse can also contribute to homelessness. Substance abuse can lead to job loss, strained relationships with families and friends, and financial instability. As the negative consequences of addiction mount, individuals may find themselves without a support system or a stable living situation, ultimately culminating in homelessness. The challenges faced by homeless individuals with substance abuse issues are compounded by social stigma and limited access to healthcare services. The pervasive stigma surrounding addiction can create barriers to seeking help, as individuals may fear judgment or rejection from society. A cycle of unmet needs. Kensington Avenue in Philadelphia, a thoroughfare once known for its historical significance, has unfortunately gained notoriety in recent years due to the profound impact of drug abuse and the opioid crisis on its street. As one of the epicenters of the opioid epidemic, it has become a stark representation of the challenges faced by urban communities struggling with addiction, homelessness, and the associated social issues. The heart of Kensington is marred by open-air drug markets where individuals grappling with addiction seek solace in the consumption of opioids and other substances. The prevalence of makeshift encampments, tents, and discarded syringes paints a disheartening picture of the human toll exacted by the opioid crisis. Homelessness is not merely a consequence of economic hardship, but is intricately linked to the pervasive drug abuse that permeates the area. Many individuals experiencing homelessness have succumbed to addiction, using substances as a means of escaping the harsh realities of life on the streets. The encampments, often located in abandoned buildings or vacant lots, serves as temporary refuge for those with nowhere else to turn. Emergency responders and healthcare providers in the area are strained, responding to a relentless stream of overdose cases. The widespread use of potent opioids, such as fentanyl, has contributed to the severity and frequency of overdoses, placing an immense burden on local emergency services and healthcare facilities. Community organizations and activists have rallied to address the crisis on Kensington Avenue. Harm reduction initiatives, including needle exchange programs and distribution of naloxone, an opioid overdose reversal medication, aim to mitigate the immediate risk associated with drug abuse. However, these efforts face substantial challenges in the face of systemic issues such as poverty, limited access to healthcare, and the pervasive stigma associated with addiction. Addressing these interconnected issues requires a combination of prevention, harm reduction, and treatment strategies. The case of Kensington Avenue in Philadelphia serves as a stark reminder of the urgency to implement comprehensive interventions at the community level. The rise of drugs like xylazine underscores the ever-evolving nature of the illicit drug market, demanding a proactive response from healthcare professionals, law enforcement, and community leaders. To effectively address the multifaceted challenges presented by drug abuse, society must foster an environment that prioritizes mental health, rehabilitation, and support for those affected by addiction. Only through a concerted effort and collective commitment, it is possible to break the cycle of drug abuse, homelessness, and the opioid crisis, paving the way for healthier and more resilient communities. Drug abuse and its repercussions have long been pressing issues that transcend socioeconomic boundaries, affecting communities globally. The intertwining challenges of drug abuse, homelessness, and the opioid crisis have created a complex web of social issues that demand careful examination. In recent years, the emergence of novel substances like xylazine has added another layer to this intricate problem. The opioid crisis in the United States has reached alarming proportions, claiming countless lives and devastating communities. Characterized by the widespread misuse of prescription opioids, such as oxycodone and fentanyl, the crisis has given rise to a surge in opioid-related overdoses. Factors contributing to this epidemic includes overprescription of pain medication, inadequate regulation, and the subsequent transition to illicit opioids in the healthcare system. Addiction often leads to a vicious cycle of unemployment, homelessness, and criminal activity, amplifying the strain on society. Originally intended as a veterinary tranquilizer, xylazine has found its way into the illicit. The drug, known colloquially as tranq or zombie, poses significant health risk due to its potency and unpredictable effects. Xylazine exacerbates the challenges posed by the opioid crisis, as users may unknowingly ingest it alongside other substances. The drug's sedative properties can lead to respiratory depression, increasing the likelihood of overdose. Moreover, the emergence of xylazine highlights the adaptability of the illicit drug market and the constant need for vigilance in addressing new threats. Emerging drug trends pose an ongoing challenge for public health, law enforcement, and communities worldwide. As societal dynamics evolve and the global landscape of drug production and distribution changes, new substances continually emerge, presenting unique risks and complexities. Understanding and addressing these emerging drug trends is critical to developing effective strategies for prevention, harm reduction, and treatment. The alarming potency of synthetic opioids increases the risk of overdose even with small quantities, posing a severe threat to public health. Of existing compounds. The rapid pace at which new NPS are synthesized challenges regulatory efforts as legislation struggles to keep up with the ever-expanding list of these substances. Cathinones, commonly referred to as bath salts, represents another category of emerging drugs. These synthetic stimulants can induce effects similar to amphetamines or hallucinogens and have gained popularity in certain demographics.